Okay, well, welcome to all of you who are here already on behalf of the League of Women Voters of Seattle-King County. I'm Heather Kelly, the president of our local league, and we are a nonpartisan grassroots organization defending democracy and involving our members and the public in government solutions to the challenges throughout King County. We appreciate your donations to support events like these. And of course, we always welcome new members. There'll be a link at the end to join us if you'd like. I'd like to acknowledge the land that we're on tonight, the Coast Salish and Duwamish people. And as a nonprofit, I acknowledge that we're part of a colonialist system that stole their land and attempted genocide, and that the oppression of those tribes is ongoing. I recognize them as the original stewards of this land, and it's an honor to be here tonight talking about one of the issues that disproportionately affects Native people here in King County, which is homelessness. With that said, I want to welcome anybody who needs closed captioning tonight to go ahead and I believe there's a closed captioning function. If somebody can unmute and point to that. So click at the bottom of your screen, you should see an option that says live transcript. And if you click that, it'll bring up a menu. You can go ahead and click show subtitle to toggle the closed captioning on. For tonight's program, if you have questions as the panelists are speaking, you can go ahead and use the Q&A function also at the bottom of your screen. If you're asking a question, be mindful that we're going to be answering the questions at the end of the event. So if there's a way to kind of provide some context in your question about what was being said that generated your question, that way we'll know exactly what topic to come back to when we read your question at the end. We're going to limit chat tonight, so you can look in the chat for resource links, but we won't be allowing attendees to ask questions there. You can use the Q&A function instead. It's my pleasure to introduce our moderator for the evening, Erica Barnett, the editor and publisher of PubliCola, a Seattle-based news and politics website, and the author of Quitter, a memoir of drinking, relapse, and recovery. Prior to co-founding PubliCola in 2009, she was a reporter and an editor at alt weekly newspapers in Seattle and Austin, and a freelance writer covering homelessness, gender issues, and environmental policy. So let's begin tonight's program entitled Homelessness, a New Approach or More of the Same. Take it away, Erica.
Thank you, Heather. So as the title of tonight's program suggests, we're going to be taking a closer look at the new regional approach to homelessness, starting with a conversation about the root causes of homelessness. We're going to talk about individualized evidence-based solutions that get beyond rhetoric and blame. And we're going to talk about some of the political challenges facing advocates and government agencies that are working to address homelessness. And finally, obviously, we're also going to get into whether this integrated regional approach and the Regional Homelessness Authority will get us closer to solving a problem that is so challenging that it sometimes feels intractable. Each of our speakers this evening will offer a brief presentation, punctuated by questions from me, most likely, followed by a question and answer period with all the panelists. And then we'll open it up for audience questions, and the process for that, Heather described. Just put your questions in the Q&A and we'll get those at the end. Here to kick things off is Alison Eisinger, the Executive Director of the King County Coalition, Seattle King County Coalition on Homelessness. The coalition works to advance solutions to homelessness, protect and strengthen the civil rights and dignity of people who are homeless and poor, and to accomplish legislative victories that promote housing, human services, and the public good at the local, state, and federal levels. For 37 years, they also coordinated the annual one-night count of the region's homeless population. So Alison, I'm just going to sort of start you off with a question to set the stage for us. What are some of the biggest challenges the region faces in addressing homelessness, and what would a successful regional strategy look like? We're starting with an easy one.
Right. Thank you, Erica. Well, good evening, everyone. It's a pleasure to be here, and I will just take a moment, Erica, thanks for the kind introduction, to say that I have the privilege of serving as the director of the Seattle-King County Coalition on Homelessness, and we are not a service provider, and we are not, despite what our name sounds like, a government entity. And the coalition's mission is to mobilize our community to challenge the systemic causes of homelessness and to advocate for housing justice. And in responding to the two rather weighty questions that you're posing, I will say, you know, some of the obvious challenges that we face, not only in King County, in our region, in our state, and in our nation, are that we have structures that create and perpetuate homelessness, and an extraordinary gap between the need for housing, one of the most basic human needs, and the availability of housing. And that is both historic and also, to some extent, a product of less than 10 years in its intensification. So we have, through the coalition's work, you mentioned, carried out the count of people who are without shelter. And, you know, here in King County, we saw modest increases, I guess you could say, but a significant change that I think really any way of measuring that you choose to use reveals, which is around 2013, 2014, dramatic increases in the numbers of people experiencing homelessness. And that is very closely and very clearly tied to the increase in rents. That is one of the clearest drivers of the increase in homelessness. It's not to say it's the only source of it, but you know, I think probably most people here understand, and my fellow panelists have said in their own ways, as I'm about to, you know, the solution that we need is housing, and the fundamental lack that we are experiencing is housing. Now, there are all sorts of political dynamics, including the dynamics in Olympia, the ways in which Seattle and King County are seen as, because they are the most populous and the wealthiest parts of our state, as having a particular flavor in the approach that that our elected officials in who represent us in Olympia take. But fundamentally, we're reaping what we have sown or not sown in Washington state and at the federal level. We're also at a point where there is an incredible opportunity to shift that. In part, we hope, because of the creation of a regional entity that is charged with, in its name and in its functions, taking a regional approach to homelessness. And, you know, that is not Marc's purview alone. That is the product of seeing the splitting that has happened between Seattle and suburban cities, and between urban, suburban, and rural areas. But also because, strangely, because of the global pandemic and the enormous additional pain that the COVID-19 crisis has brought on top of homelessness in our community, we have more resources. And so I think the answer to the question about what are the barriers should also be balanced with what are the opportunities. We have, in some respects, unprecedented state and federal resources available to us, but you cannot turn on a dime when your system has been underinvested in systematically for decades. And those are some of the challenges that we collectively face. And I think I'm really just going to, if I may, well, you may have other questions for me, Erica. Feel free to lob them my way. I thought I would just point out a couple of things that really are resonant for me and for the coalition's member organizations, which include large agencies that provide a wide range of services, including housing and behavioral health care like DESC, and very small all-volunteer organizations. Our members, the frontline staff, the folks who themselves have personal experience of homelessness and unstable housing have, to a very large degree, both been considered essential and abandoned during a global public health crisis. And that is significant as we gather here tonight to talk about what's going forward, because, and I don't want to steal what I hope Daniel will speak to, but there are those of us who, having lived through the last 20 months, are very clear. We're never going back to some of the things that were accepted as standard or even good ways of providing care pre-COVID. And those are things that we can talk about tonight, but they include recognizing, as we have said for many, many years, people are homeless 24 hours a day. The idea that we would allow people who are lucky enough to get access to shelter to show up at 9 or even 10 o'clock at night, but not to line up and be seen before then, so that they can lie down on a mat on the floor and then be up and out by 5:45 in the morning without a breakfast, as some sort of an adequate publicly funded response to this crisis, should be buried and gone. The fact that people need and benefit from privacy and the ability to set their own sleep schedule and eating schedule is something that we have seen in the transfer of people from congregate shelter to hotels. So those are positive things that can and should be sustained as we hope work our ways out of the depths of this crisis. But at the same time, there are some fundamental structures like the gap between what we expect people who are disabled to live on, $197 a month, if you're lucky in this state, and what it costs to pay the rent. Those things are going to take really concerted policy efforts to shift.
Let me jump in with just a quick question, well, a semi-quick question, which kind of gets to some of the discussion that we were having prior to this panel tonight about, and I think a lot of people have questions about the provision of shelter in the absence of housing. Given that there is this tremendous gap and a tremendous shortage of housing, and housing is slow and sometimes quite expensive to provide. The incoming Seattle mayor, Bruce Harrell, has said that he wants to add 2,000 non-congregate emergency shelter beds in the first year, and then simultaneously ensure that parks and sidewalks and public spaces are clear of encampments, which is essentially the Compassion Seattle plan that didn't end up making it onto the ballot. I'm just wondering, within current resources and without additional funding, is this a realistic goal, and should it be our goal in the region? What do you think, Alison?
Is this a realistic goal without new resources? Absolutely not. And I think that Bruce Harrell knows that. And I will say this, 10 years ago, perhaps more than that, I wrote with now Representative Nicole Macri a position paper that described what we referred to as the role of shelter in ending homelessness. Not that it is sufficient, but that it is necessary. We have to respond to the immediate crisis and the needs of human beings for safety, warmth, survival. But the idea that in 2021, when we are all painfully aware that having a home is a key determinant of individual and community or public health, that we are going to be patting ourselves on the back for somehow creating an additional 2,000 units of shelter without talking about what it costs to do that. it pains me. And it pains me not because I'm opposed to the city of Seattle setting itself the goal of rapidly creating additional thousands of safe shelter spaces for people, let's say. It pains me because I've been at this long enough to have served on multiple so-called emergency task forces. I've been at this long enough to remember when former Mayor Ed Murray declared a homelessness state of emergency in an extremely cynical move with a one-time $5 million investment that included 100 additional shelter beds. So I would hope that we are past the point where any proposal that doesn't include a clear plan, excellent ways to measure the implementation of that plan, and sustained funding for the plan is not to be taken seriously. I mean, I should note, many people who helped put this evening together are aware of this, but the Seattle-King County Coalition on Homelessness, together with the ACLU of Washington and the Transit Riders Union, brought the lawsuit that meant that Compassion Seattle was not going to be on the ballot. And one of the reasons that we did that was because it is what I would politely refer to as an unfunded non-plan. But we have plans. We have spent as our community an extraordinary amount of brain power and capacity to study, learn from, and make plans based on our local and national best knowledge and practices. The question right now is, how are we going to pay for things? How are we going to implement? And how are we going to sustain a system that drives towards housing and doesn't think that shelter is where the primary focus needs to be? And again, I want to be clear, I am in no way opposed to shelter. The Coalition on Homelessness actually fought for and created hundreds of shelter beds over the years. I'm thrilled that people are understanding the need for additional good shelter. I think that my fellow panelists probably agree with me that it is a necessary but in no way sufficient piece of what we really need to talk about if we're going to talk about ending homelessness.
Well, I think that's a great segue to our next speaker, Daniel Malone, the Executive Director of DESC, because DESC, as some of you may be aware, was a shelter provider that shifted to a hotel-based model during the pandemic, and is not going back to the old to the old congregate model, I should say, because of a lot of the benefits that Alison talked about. So I'll introduce Daniel. DESC, as I said, he's the Executive Director of DESC. It's a nonprofit organization serving people experiencing homelessness and living with behavioral health disabilities and other serious conditions. DESC provides survival and crisis services, behavioral health care, and permanent supportive housing. Daniel has been at DESC for the past 31 years, serving as Executive Director for the past 5 years. So I want to start off, Daniel, just by saying you've spent most of your career designing, implementing, and evaluating programs for chronically homeless people, that is people with disabilities who have been homeless for a long time, to sort of, dumb it down. People with substance use disorders, people with serious mental illness, the kind of people that we often think of when we think of the visibly homeless population in Seattle. What are some of the particular challenges faced by people with disabling behavioral health conditions? And what are some of the best evidence-based strategies for housing and helping them?
Thanks, Erica, and thanks to the League of Women Voters for having me participate in this. I'm very glad to be here. So I am here to share some optimism, I think, but I'd like to start with a little context. Specifically about the group that you mentioned, people who experience homelessness for long periods of time and have these profound disabling conditions. And those are the folks who tend to wind up homeless the longest and have the greatest barriers to exiting homelessness. And some of that gets misunderstood, that it is about the conditions that these individuals have that makes them unable to be successful in society or in being housed. The truth is that we have a society that doesn't treat people with these kinds of conditions very well, and it manifests in lots of different ways. It is certainly common that when people start to show signs of a serious behavioral health condition like schizophrenia or other major mental illness, or develop a serious substance use disorder, that occurs in adolescence and early adulthood, which really interferes with a person moving into that next stage of life and being successful in starting a career and that kind of thing. It is also oftentimes very accompanied by disruption to family life, and sometimes it involves behaviors that result in a person no longer being able to receive support or otherwise be accommodated by their families. And so quite often people with these kinds of really difficult conditions end up relying on public systems for support. And those systems are wholly inadequate. For starters, if you are qualified to receive an income from the federal government based on having a disability and you don't have work history to base that on, you get SSI, Supplemental Security Income, and today the payment amount is just shy of $800 a month. Is what is the entirety of the income that you are provided to live on. Of course, that is an income amount that isn't based on where you live. It's based on having been approved for it. So if you live in Seattle and you receive SSI, you get roughly $800 a month. If you live in Tuscaloosa, you get roughly $800 a month. The difference between those two areas, just to pick another one randomly, is that in the other place, there might be apartments that one can acquire for less than your income. May not be the highest quality kind of living environment, but it is mathematically within reach for you based on your income. In Seattle, that doesn't exist. There is no market-based, extremely low income housing that exists in the community any longer. And so you are left needing housing that is subsidized. And there is a huge gap between the number of people who have fixed very low income and the number of subsidized housing units that exist in the community. So you end up with lots of people who find themselves experiencing homelessness in a community like this. And that has only increased quite a lot in recent years. Then the experience of homelessness for somebody is extremely hard. And people go through all kinds of traumatic events when they're living homeless, either because specific things happen to them or they're subjected to, predatory behavior or the effects of weather, or just the uncertainty of knowing what is going to be in store for you next in life. And that takes a toll on people, on top of the very difficult kinds of conditions that people may have had developed already. And so all that is to say is that our society is not geared toward very well meeting the needs of people with these kinds of conditions, and the experience of homelessness exacerbates them quite significantly. The good news, though, the optimism, is that everybody's housable. And there's ample evidence to show that people with the most profound kinds of disabling conditions and the longest experiences of homelessness can be successfully housed when it's made available to them in ways that work for a person. Usually what that has meant through what we refer to as a housing first approach is that somebody isn't expected to have cast aside the different kinds of disabling conditions that they have been experiencing, that they don't have to agree to make changes in their lives, to participate in treatment or other kinds of services, and then are able to make daily choices for themselves about how they want to live their lives. That has proven to be attractive to people, including many people who have not availed themselves of other more structured kinds of interventions that might have been made available to them. And it turns out it's also quite successful for people. People move into and stay in this kind of housing for very long durations. And when they're in those kinds of settings, their lives get better. In some ways, their lives get better dramatically right off the bat. And in other ways, their lives get better gradually over time. There is a lot of trauma to undo, and that doesn't happen immediately. But there is significant research evidence showing how people do better when they become housed in these sort of low barrier types of approaches, where they're also provided with a significant amount of support to help them be successful. It's just that the support is arranged in a way where the person is asked what it is they want, and it is aimed at helping them be successful as they define being successful, as opposed to a more typical kind of social service experience somebody may have experienced over their lives, where they're expected to conform to the expectations of the program. And while that kind of thing can be great for lots of people, by the time somebody is experiencing long-term homelessness on the streets, chances are they've gone through those other kinds of programs and it hasn't been successful for them. So anyway, all this is to say is that there's reason to be optimistic, because we know that people can be successful, including people who many folks would have said are unhousable or are, shouldn't be housed because they first need to get better from whatever it is that has been ailing them.
Can I just ask you just briefly to address something, to just sort of zero in on that a little bit? I mean, I think that, you and I have talked a lot of times about over the years about, this idea. I think you put it to me one time that people think there's a magical treatment car wash that you can go through. And I think about that quote a lot. Because I think that there is a myth, and it's probably a myth that's ultimately born of hope, that there is an easy or at least a simple solution for people with really complex problems. Can you just kind of drill down briefly on on why what that myth is, and why it's wrong, and how we can kind of replace that sort of magical thinking with evidence-based thinking and with solutions that work, even if they're not simple?
Yeah. Thanks for bringing that up. I do think that what everybody in the community wants is for people to do better and have more successful and happier lives. And we have all been conditioned in our society to hear about and believe that there's treatment for these kinds of conditions that people have, and that it works. And let me just say, I believe in treatment. The organization that I work for provides treatment. We're licensed to provide mental health treatment, to provide substance use disorder treatment. That is a major part of the work that we do day in and day out. What we struggle with in doing that work is being successful with people when their lives remain chaotic. And so the kind of notion that there is a treatment that you can participate in while the rest of your life is not being addressed, and expect to be successful is way off base. And also, I think a lot of people then believe that, well, okay, bring somebody to a different setting for that treatment, inpatient treatment, go somewhere. Often people have in mind some bucolic setting that a person can go be in for an extended period of time of weeks or months, or perhaps even longer, and work through all of the issues in order to be ready to tackle independent life in society. And we just don't see that is how things actually work out for people in the end. It just doesn't happen that way very often. So our experience is that make available to people treatment, but do it along with addressing the daily needs that they have of a safe, stable place to live, access to quality food, people around them who provide expressions of care and support and hope. And people are much more likely at that point to avail themselves of treatment and start to be able to utilize it more successfully.
Great. All right, we're going to move on, and we'll be coming back to Alison and Daniel at the end of our presentations. I want to move on to our third speaker, Marc Dones. Marc is the director of the King County Regional Homelessness Authority, as all of you probably are well aware. Marc is a social entrepreneur, policy strategist, and social justice activist with more than 10 years of experience in equitable systems transformation across local, state, and federal governments. They played an instrumental role in designing the regional authority before becoming its CEO earlier this year. Marc, you are in the unique position of setting up a new homelessness system at the same time as you are also working to course correct a system that already exists. Tell us a little bit about what it means to take a regional approach to homelessness, what kind of system-wide changes we can expect to see in the coming year, and I guess most importantly, what success will look like. So just to kind of start off, what are the top 3 goals that you and your team hope to accomplish within the first year of the authority's existence?
Sure. First, thanks for having me. Hello, everyone. Hi, Alison's cat. I don't know your cat's name. What's your cat's name?
Minka.
Hi, Vinca. Yes, I want to echo something that Alison said as a bridge, actually, which is, I come to this role from a lot of work doing transformation. I also come to this role having done transformation in some blank slate environments, frankly, where there was not something, and I've done it in places where there is something, and we need to do the course corrections that you just talked about, Erica. And I think that one of the things that is really critical to understand and to underscore is what Alison said about it is not possible to turn on a dime inside a system that has been chronically underfunded for 35, 40 years, right? It's just we don't there are, I was thinking about the resources that Alison was talking about, but one of the things I think that Alison, Daniel, and I have all talked about with each other, with everybody else, right, over the last several months, is we can't, there's money we can't spend, right? We don't have staff, there are spaces right now in the county that we could put programming in, we couldn't operate it, right? There's no staff to do it. Some of our larger agencies have hundreds of vacancies and no pipeline because we don't have the salaries and the benefits and the things that people are looking for, right? And the reason we don't have them is not because we as leadership in the space are oh, those things are gross, living wages, yuck. The reason we don't have them is because we haven't ever been funded to deliver them. And so I just can't underscore that enough, that the resource problem in this system is not just at the level of we don't have the housing, we don't have the stock, right? It is bone deep. We don't have the resourcing to staff the stuff we do. And that, I think, is something that has to be at the core of any conversation about what kinds of change are possible. Because at the end of the day, right, like the delivery mechanism for all the treatment that Daniel was talking about is people. Like, you know, I've been institutionalized twice. I talk about this, right? Like, the people who got me like to where I am are people. Like, I didn't read the treatment manuals and be like, oh, I get it, right? Like, so I think we just have to like keep that really front and center, because I really, really, really want to underscore that, like, if we hadn't under-resourced this system for 30 years, if we had people, if we, you know, we could do some incredible stuff tomorrow. Because at the core of it, and I think the optimism that people are bringing to this conversation is we actually do know how to house people, right? Like, we know how to house people, we know how to support people. Like, you know, those of us who have lived experience with some things, like have been on the benefit of some things, and frankly have critiqued some things that don't work and that we are going to wind down. But like, you know, that world is not mysterious. The resourcing and how we're gonna, I think, sort of frankly, finally have an honest conversation, or maybe like have a conversation that yields resources, that feels mysterious to me a little bit. So what I will say in terms of just like stepping away from that and then saying, okay, so what do we actually want to get done, right? I think there are three key things that I would like to see done inside sort of my first year in this role. The first is a full-scale redesigning of the RFPs, right? The sort of the things that like contract out the services. I think, like, you know, through a lot of collaborative process with people experiencing homelessness, both current and prior, and with our providers, we already know a lot about what doesn't work. But in terms of how the current contract vehicles work, and I know this is like really boring and administrative, but it actually matters to how people are able to then deliver the thing or support people, right? And I think what we need to do is in sort of Q1 and a half, right, is have a community process that essentially puts a bow on what we already know, right? And builds a better set of vehicles for delivering the things that people really need, and shifts, right, sort of how we do our work across all auspices to be really oriented towards producing like dignity-based environments, really leaning into peer-led spaces, really trying to achieve those living wages, right? Those are the things that I think we're going to be really focused on seeing inside, you know, the RFPs for the 2023 system. So there's that. The second thing that I think I'm, you know, really focused on, and our team is really focused on, is integrating, right, in everything that we do, the voices of people with lived experience at all levels, right? And so even in staffing, you know, the authority, and you know, I've talked about my own experiences, et cetera, but our team is majority folks of color and has a lot of folks with lived experience on it, as we staff to be, you know, frankly, like to look like the community we're serving. And I want to continue that push, right? And I want to continue that push broadly at policymaking levels, at program delivery levels. And I think, you know, folks have probably heard me and other representatives of the authority talk a lot about, you know, a desire for peer navigation and you know, a focus on, you know, how do we ensure that the connective tissues between all of the things that we run are oriented towards leaning into that belief that people already know what's best for them, and that if we can resource them appropriately, they can, you know, really drive the solutions. And then the third thing that I'm hoping for is that we can have a conversation that is, honestly, I don't know how else to say this in a way that isn't harsh. I'm hoping we can have a conversation that isn't absolutely bananas every waking day. Like, there are many days I spend a lot of time like putting out fires that I don't understand. Like, I simply don't understand, like, what are we talking about, right? Like, the fundamental reality is, again, underscoring something Alison said, is that like we are in a full-blown crisis. It has been a crisis for a while. It has gotten worse, and people die. Like, I don't know what else to say at this point, right? I don't know what else I can do to be clear that when we debate whether or not it is good to invest in homelessness, people die while we have the conversation, literally while we have the conversation. And so what I need us to do as a community is act like the word crisis means something. Like, that's the third thing that I need us to get to, right? Is that we have to say that an emergency is not just, again, to Alison, I'm just going to quote Alison today, all right, is not just a thing that we put on stuff in order to make ourselves feel better about a lengthy planning process, right? Like crisis response is very different from other forms of governance, and we have to start acting like that. And so what we will be doing at the authority is shortening our planning periods and then moving into like short planning, implement, watch what fails, iterate, do it again, right? Like, that's how we have to start approaching this, because otherwise we get into this pattern of like, I can't, like, my career is shorter than Daniel's. I have been part of 5 like multi-year plans to end homelessness, right? Like, we just do this thing where we keep planning and planning and planning and never actually doing anything. And so if we don't actually break that mold and get into a serious and consistent bias towards action, I fear that nothing actually will change. And that, sort of the banner of this event of like more of the same or not, the significant game-changing difference is, do we take any of the good ideas we have and execute them?
Can I just ask about, I mean, one of the challenges I think that you're going to face more perhaps than the city of Seattle faced is that, you are looking at an entire region and doing sub-regional planning among regions that do not agree with you or with Daniel or with Alison in some cases. And by regions, I mean, the political leaders in some of these suburban cities who do not agree that the evidence-based solutions that you're describing are in fact evidence-based solutions. And so, I mean, suburban cities in this region have, explicitly passed laws rejecting supervised consumption sites. They have opted out of the health through housing sales tax. How is the regional authority going to work with those parts of the region that do not agree, on the evidence-based solutions, or perhaps on solutions that the regional authority chooses to go forward with? And what's it going to take to get them on board with this idea of a truly regional approach?
I really appreciate that question. I think, for me, part of that answer has to be inside how we, sorry, I'm hearing like a really loud banging out my window, and I was like, I wonder if I should be concerned about that. But I think part of that, I've decided no, in case anyone was curious. I think that the answer to that has to be, things are true. Like, so let me start there, right? Like there are some things that are true, and I think oftentimes what is the difficulty is that like there's a narrative around stuff, or people frankly think that a thing means a thing that it doesn't, and we need to have that conversation. And I also think that, like, what I have found the most successful in sort of depolarizing conversation in this space. I did a lot of work in youth and gang violence earlier in my career, which is also an intensely polarizing issue. So maybe I just like polarizing issues. But the best way I have found to have conversations is to start with the outcome that we all want to see, right? And then walk backwards. And the bottom line is, I do fundamentally believe, whether or not it is naive or not, I believe that even people I am diametrically opposed to actually want the same thing at the end of the day, right? Which is for people not to have to live outside because we have failed them in every way. And if we can start there, right, with that, we agree that that's the outcome that we want, and then walk backwards through, well, how do we get there? That I have always found to be a much more productive conversation than trying to fight my way forward without having established a common end goal. I also think that, like, what we are approaching through our sub-regional work is trying to really lean into place-based strategy. And you know, I think that there are fundamental realities about what will work in a given jurisdiction versus what won't. And a lot of that is, you know, has to do with what is available, right? Like, you know, to Daniel's point, like, you know, what is the rent here? They're like, you know, like quite literally where things are located often makes a really big difference with regard to people's ability to access other kinds of community supports, et cetera, et cetera. Communities are communities. And so even if I fully disagree with like everybody in a community about everything, at the end of the day, if I don't live there and they all believe that thing and someone is trying to access something in that space, right? Like the idea that of sort of like that hostile environment, right? That's a real thing. And so what I want to make sure is that we have the appropriate infrastructure for what people experiencing housing insecurity at scale in all of the subregions, so that people don't have to bop around the county to get the stuff that they need. I've been very clear about that goal. And we're not going to step away from that, right? And there simply cannot be a regional solution without us having the regional infrastructure to carry it.
All right, I'm gonna move on and we will come back to everybody. But I want to give some time to Cynthia Stewart. She's our final speaker. Cynthia is the Housing and Homeless Issue Chair for the League of Women Voters of Washington, and the president of the League of Women Voters of Tacoma Pierce County and of Thurston Community Media, as well as the immediate past president of Hearing Loss Association of Washington. And she lobbies for the League of Women Voters Washington on a wide range of issues in Olympia. She's been actively engaged in the homelessness issue over the past 5 years. And she's gonna review some of the actions that the legislature has taken over the last several legislative sessions to expand funding and create more opportunities for local governments to address the homelessness crisis. And also preview some of the actions that legislators are going to take or will likely take in the upcoming 22 session, which is a short session, and provide a little information about how League members and others who are interested can weigh in on these issues with the legislature.
Well, thank you. It's really an honor to be here, and I appreciate this forum very much. And I've had a lot of inquiries from people around the state actually asking about whether they could attend tonight. So they read about it in a League newsletter or something. So this is really a powerful tool. I'm going to show a PowerPoint in a minute because I have so much detail it would be impossible to aggregate and summarize it without that. But I want to start by saying that one of the problems that the legislature has is that they're trying to put together solutions that match Eastern Washington, Western Washington, Seattle, Chehalis, Centralia, and who knows where. And they, as Marc pointed out, they all have a different point of view, and it's a bigger difference than we have just in King County. So that's the first point I wanted to make. The second point I wanted to make is that when they started working on homelessness issues intensively was in 2018 and 2019. And in that period of time, they were just beginning to learn about what some of the causes of homelessness are, what some of the people who are experiencing homelessness are actually going through, what some of the agencies serving homeless people are experiencing and what their needs are. And then hearing from local elected officials about what their problems are. So they started with about a 2-year process of educating themselves before they started passing any legislation. So I'm going to show my PowerPoint here as a way of kind of simplifying this. So in the last, let me just see if I can go to. So 2018 and 2019 was an education process, and they've gone through in the last 4 years a shift They started out with what's going on, what are some simple solutions, realizing simple isn't the right answer, and then moving to some financial and policy efforts and realizing that isn't working either, and then going more towards a regulatory approach. And so that's a trend that they've gone through. And part of it has to do with the fact that local governments are not responding as quickly as they had hoped. So even though local governments have been more tuned in for a long time, there are issues around not in my backyard. I don't want to do anything. These people don't need my help. They just need to shape up. Those kinds of public attitudes are out there, and elected officials respond to that. So we have this gap between what's really needed that you've heard tonight. And I've been engaged in this issue in Pierce County for over 5 years now, and fully engaged. And everything you heard tonight is true. Elected officials aren't all on board in that same regard. Anyway, what I will go through describing what kinds of things have happened, and then we'll talk about what is coming in 2022. And I just want to say that 2022 is a short session, 60 days. So they will be picking up bills that they haven't addressed yet that are lingering from 2021, and then they will have a few new bills and some funding proposals that is specific to 2022. But the opportunity to get through all that is pretty limited in that time frame. So another issue that exists here is that we have more money that's available if we were to prioritize it and reallocate it correctly. But one of the problems is that we're spending money on police services and emergency room and mental health facilities and all kinds of other jail costs, that if those costs were reallocated into housing, we would actually save money and lives. And yet we can't really easily do that because the way funding is set up. The second point is that local governments are underfunded as a rule, and counties more than cities. Counties do not have all the same funding opportunities that cities enjoy. And so they're strapped. They've been strapped ever since the recession in 2008, 9, and 10. And it's really, really hard for them to figure out what to do without any money. So the legislature has gone through some ideas. One of them is changing the real estate excise tax. That's what REIT is. The real estate excise tax is a tax you pay when you sell a property, and you pay the tax on the income. And so they've allowed real estate excise tax now to be used by local governments for housing purposes, as well as prior infrastructure and parks. The problem with that is it was being used for infrastructure and parks. And so if they divert it to housing, then they're foregoing some of those other opportunities, but they're trying. Then there was a bill 1406 that allowed local jurisdictions to retain a portion of the state sales tax that's already been paid. It's not a new tax, and they can use that for housing purposes. And then the opportunity to use 1/10 of 1% for housing and adopt that by councilmanic vote instead of putting it on the ballot. And putting it on the ballot was prohibitive in most jurisdictions, so they changed that opportunity for local governments. And then another really big shift, which is not specific to housing, was changing to the capital gains tax and combined with the working families tax exemption, which should raise a little bit more money in the state government, but also make our tax structure a little bit more equitable. So getting more money from people with wealth, giving back some money to people on the lower end of the income spectrum is intended to partially help the housing situation because it puts more money in people's pockets. Another policy issue has to do with density. What developers have said for decades is just let us build more and we'll have more supply. Well, that's not really happening. They're building more, but they're charging more. And it's not at the volume that it would take to actually provide affordable housing for people at low incomes. So in addition to that, local governments are having a really hard time selling that increased density idea to their public. And so different approaches have been legislated to go from offering opportunities to increase density all the way to mandating that certain kinds of density has to be allowed. They've also gone through a series of tenant and foreclosure protections and different kinds of extending deadlines for giving eviction notices, changing different kinds of requirements that landlords have, so that people are not kicked out of their homes prematurely. And this has been a particular issue during the COVID pandemic because so many people have been under and unemployed. And so there was horrible fear of massive evictions and massive additional homelessness. So several bills were passed to address that concern. Then there have been some bills that increase the opportunity to install shelters, for example, on faith-based organization property and that kind of thing. And then permanent supportive housing has been supported more. There's now a requirement. So they've gone from offering opportunities to now all the way in 2021, House Bill 1220 was passed, which now requires that every jurisdiction subject to the comprehensive planning requirements of the Growth Management Act has to have a plan to accommodate housing for everybody, ranging from market rate to low income, to severely low income, to homeless people and shelter. And they have to have that plan by June of 2024. And that's because nobody was doing it. So they went ahead and mandated it. So this will be really interesting to see what will happen. And then finally, a bill was passed to set up a universal basic income study, and that information will be available at the end of 2022. And we can look at that in 2023 and see what that study found. And I go back and just what we know from other evidence is that providing a basic minimum income will actually stabilize people and keep them often from losing their homes when they might lose them if they just had a little bit less money. So that income can be extremely beneficial. So in terms of funding opportunities, the state has invested heavily in the Housing Trust Fund. The Housing Trust Fund is a low income loan opportunity, low interest rate loan opportunity for private nonprofits that provide low income housing, affordable housing. And they've invested first $100 million, then $400 million, and then we're asking for another $400 million this coming year. That's still not enough, but it's significantly higher than anything they've ever done before. Those are historic investments. The Housing and Essential Needs Program is a program that provides certain kinds of payments for people who just need one thing to keep in their house and not lose their home. So it might be a utility payment, it might be a rent payment, it might be some other kind of a financial assistance for a limited amount, but that has received significantly higher funding than ever before. In terms of youth, the McKinney-Vento program in the public schools, if you look at those numbers compared to the other numbers, it almost doubles the actual count of people who are experiencing homelessness. And what we also heard as testimony in one of the committees 2 years ago was that 40% of community college students are experiencing homelessness, and not as many of the 4U universities, but many. So what they've done is provided a number of programs for college students and for young adults who have moved out of the foster care system, and for kids on the street who need some extra support. And then there's been a big rental assistance push, particularly during the pandemic, because there's been a lot of federal money allocated for that. And that rental assistance program hasn't necessarily been uniformly well managed, but in the places where it has been managed properly, it has saved a lot of people from losing their homes. And then finally, there's a new $100 document recording fee for homelessness programs. $100 fee is if you file a document with the auditor's office, you pay this $100 fee. And the rationale and the nexus is that most of those documents are property sale related, so that you can justify the $100, which is almost not noticeable if you're buying or selling a house, for example. That goes into homelessness programs and is brand new money and available in a way that hasn't been possible before. So all of that is background to say that in 2022, coming up next month, I'm working with the Washington Low Income Housing Alliance, and I just want to say that they really should get the credit for anything that I have to say here, because they've been my mentors and they do the research and they've just been fabulous, and I can't say enough about them. But another $400 million is going to be requested for the Housing Trust Fund. I don't know if they'll get it, if we'll get it, but we'll try. The Housing Justice Act is one that prohibits using criminal records as a reason to decline housing to somebody. The cash grants for aged, blind, and disabled, I think we heard earlier tonight, $197 a month. The proposal is to take that up to almost $500 a month. Additional tenant protections. Another proposal that I haven't heard before this is to register for-profit landlords so we can track what's actually going on. One of the things that keeps coming up in discussions is, why can't we have rent control? And that's just not politically palatable. But one of the things that we know is that there's not enough data about who is actually renting property. Are they paying taxes on it? How much are they renting it for? When are they, and how much are they increasing the rent, and that kind of thing. And there's an attempt that is being proposed to actually get a grip on that. And then what's also happening is that many of the nonprofits around the state who are providing services to people who are experiencing homelessness or who are at risk, their employees are not being paid well because they're nonprofits operating on a very slim budget. So part of the intention for this coming year is to ask for more financial support for those organizations so they can pay their employees better, who might be at risk of being homeless themselves. And then finally, the House Bill 1220 that I mentioned that requires comprehensive planning for housing, most jurisdictions do not have the talent on staff to do that. So the intention is to ask for funding support for each of the local jurisdictions required to do that kind of a plan so that they can actually accomplish that and not just brush it off. So I'm just going to briefly say the League has both a national and a state position that allows us to lobby. We can't lobby on anything for which we do not have a position, but in the housing category, our positions are fairly broad. So the National League says the responsibility resides with government at all levels and with the private sector. What we know now, though, is the private sector is not stepping up, never will step up, and government has got to fill some gaps or we won't have solutions. The state league's position is, again, similar. All levels of government and the private sector share the responsibility, and that the planning to meet those needs is best done at the local level. So that's what is now being pushed, is getting local jurisdictions to actually do some planning. And like Marc said, there have been lots of plans and they don't ever go anywhere, but I think the intention now is to actually force that issue. And I'm hoping that will be the case. So any league member or any member of the public who is interested in getting engaged in this issue, and we would appreciate that. The League of Women Voters during the session has a weekly league newsletter. And I'm hoping somebody can put these links in the chat so that people don't have to take it off of this slide, but anybody can sign up to get the newsletter, and it's very exhaustive because it covers many issues, but you can pick and choose what you want to read. Also, last year, the session was virtual, and that was an amazing opportunity for people of all kinds, whether it's geographically just geographically far away from the capital, or whether it's people who don't have the ways and means to get there, everybody could sign in on a bill electronically if they could get to a computer, and many, many people could testify who never would have had the opportunity before. So in the one way, pandemic has actually been helpful for the democratic openness and transparency. And we encourage as many people as possible to do that, because that same opportunity will happen again this year. And then finally, I maintain a separate email list of my own, and I send out more details than I can put into the newsletter. So if anybody's interested in being on my distribution list, you can contact me there. So I guess I'll stop at that. And my cursor isn't working. And I hope that was informative. I just want to echo everything that Alison, Daniel, and Marc said. All of the things that they've described have been my experience in Pierce County as well. And there are some of us who are just really committed to getting this to change.
Thank you, Cynthia. And I am going to segue into audience questions by asking a question that was actually on my list as well, that I see an audience member asking, and that is about the point in time count of the region's homeless population. As most of you probably know, every year, historically, there has been a one-night count done for many years by Alison's organization, and later by All Home, and then most recently by King County, that attempts to basically quantify how many people are living unsheltered, how many people are living sheltered but homeless, and in what conditions. And the King County Authority is not doing the count this year. It was not done last year either because of COVID. And so I just wanted to ask, maybe put the question first to Marc. What is lost, if anything, in not doing the count, and what is the RHA going to sort of replace that with? I know that the data is a big part of your approach to to beginning to address the problem. We have to be able to define it. So how can we define the problem without doing that physical count?
Thanks. A couple things. I think there's some misconceptions about how point in time counts work, what they are, like what's annual, what's not annual. So I'm just going to level set, right? Like there is a point in time count that happens every single year. That is an administrative data run out of HMIS that looks at who is in any kind of shelter program or other kind of homelessness services program that is funded by something that previously that was funded through COC dollars at all, now is part of the homelessness system, because now that we touch all the things, right, it won't matter if it's general fund or it'll all funnel into HMIS, right? So, and that always happens, and it will happen.
And I just want to, just for people, HMIS is is basically a database of everybody who's interacting with the homelessness system.
Yes. It stands for Homelessness Management Information System.
Unfortunately,
it does. Yeah. So that is sort of de rigueur for how this work is done. What has historically been asked for by HUD every other year was something called the unsheltered point in time count, where during essentially one night in January, folks would get together and in some way, shape, or form count folks who they saw experiencing homelessness outside. There are, and Alison can speak to the history on this, frankly, in a lot more depth than I can. What I will say is, across the country, there is a lot of variance in methodology, and the reliability of the counts as a data point, right, in terms of saying this is the number of people who are actually experiencing unsheltered homelessness, fluctuates pretty significantly. and depends on the methodology employed by the jurisdiction, how consistent that methodology has been, how wide ranging the count is, whether it actually gets to, sort of all the nooks and crannies, et cetera, et cetera. There has also been, and for folks who are not sort of in the homelessness space, this is not something that I think a lot of people track. There has been consistent criticism of the point in time count as an actual data point for decades, actually, at this point, right? The Government Accountability Office, or GAO, the federal office, actually released a report on the point in time count not necessarily being the right data point for HUD to try to manage the system off of across the nation. So I want to put that context around it because, like, for me as a person who's been doing this for a long time, this is actually like not a super controversial decision. What we're saying is we think that there is a better way to understand the needs of our unsheltered neighbors than counting. Or counting in this particular way, I should add, because I do actually think there would be methodologies that we could use to count that would take longer, that could produce a potentially more useful number, or other sampling frameworks. That's beside the point. The point is that what we are saying is that this particular thing, we don't think is the best way to serve our unsheltered neighbors, and that how we can better learn about what those needs are is by collecting qualitative data. Will we now? A thing that I do want to sort of correct also in the broad narrative is, like, we'll also count the number of people who we interact with, do a sampling framework force multiplier. And that basically is a point in time count, right? So we will say, like, this is the extrapolating, this is maybe the number of people we would have talked to. But what I am saying, what the authority is saying, is we're not going to give that number a banner rollout and call it the truth. Like, it does a disservice, and I can't stress that enough. It does not, it becomes something that, because we roll it out in marquee lighting, we then fixate on, and it harms our conversation around what we do actually need. And so to the point around, like, okay, so then how do we get to numbers that are true, right? So I think two things are clear. One is, I actually think that there are better administrative data realities that are just over the horizon, and some frankly might be closer than others, in terms of being able to look across what our programs touch, how that data is collected, and get a better, and not just HMIS, right, to be clear, and get a better sense of how many people are flagging as experiencing housing instability, right? I also think that we can do a better, in particular, I will also say, right, utilities data is very interesting to me. If any of you actually want to have this conversation about why utilities data is interesting, I would love to have it with you, but I won't drag everyone into this rabbit hole right now. And then I think that there is, with regard to, again, folks who are unsheltered and not touching systems, right? Because that, like, let me be clear, like, that actually, for a one night count, like, that actually is who we would be concerned with, right? If you are unsheltered and not touching a system, like, then we have no way, right, of seeing you. I think that the appropriate methodology to understand that population is actually something called respondent-driven sampling. I'm sorry, I'm just trying to answer this question in all the technicality, but respondent-driven sampling is a framework where it happens in waves, right? So say I have 3 people, right? I then ask those 3 people to refer in 3 more people. Those now 9 people each refer, yada, 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 right? If you start what's called the seed wave, farther out from system connectivity, then by wave 4 or 5, you should actually be talking to people who are not connected to the system at all. That allows you to do 2 things. One, it allows you to hear what their needs are, right? Like, what are the things that we're not doing that have led you to not touch anything, right, that is in our funded ecosystem? The second thing it allows us to do is actually see whether or not, right, those the fourth or fifth wave are difficult to recruit. Because the farther out you get from the system, if the waves become more difficult to recruit, then that actually means that there is a natural boundary and that more people are service connected than not. It also gives you a sense, right, of if you don't have difficulty recruiting, you can actually ask people, right, how many other people do you know who aren't touching the system? And with that, right, like, again, if you then run that through a sampling framework and force multiply it, that could get you to a rough estimate. But it would just be a rough estimate. It's, again, like the actual way that we do, like, creating a real number. You're right, Erica, I'm sorry, data really matters to me. Like, the way that we do a real number actually has to be tethered to something that has a framework built around it that we actually can hang a hat on. And I think that the reality of the point in time count is, even when it's run really well, it doesn't give us a thing that is what we need.
Okay, I want to give Alison just a brief opportunity to respond, and then we'll go on to a couple of more general questions that are coming in from the audience. So, Alison, take it away.
Thanks. I will be brief because I'm watching the clock, and I know this is a topic of really deep interest. And Marc, I hear you that you're really interested in data, and I think it's important for you to know that so are a lot of other folks, including the people who organized what we called our one night count in this community from long before it was a mandate at the state or the federal level, and who actually worked with the coalition to deploy multiple different kinds of methods, including a 1,000-person in-person survey in the 24 hours after the physical count took place for many years. So lots of pieces that I'm very happy to share with you. But I think part of the response that I'm certainly hearing from many folks in the community and from people actually at the national level is because there are limits and limitations to all forms of data collection, right? We understand that. And anybody who says otherwise is not particularly being straightforward about what the challenges are of collecting information that is meaningful from human beings. This community really had deep ownership over what we did at the coalition as the one night count. And I think that was, that's part of why there's a lot of concern about the decision, which, as I wrote to you a couple of days ago, I think we can even support, because this is a time of extraordinary pressure on the folks who would be called upon to do this work. And the gain and loss framing of the question from the person in the audience, I think is a really useful way to think about it. What is lost, I think, in part after a decades-long tradition, is that this was done partly because it had nothing to do with an obligation to HUD or to the state, and everyone knew it was an undercount, and everyone who participated in it felt that they were engaging in some way in bearing witness, I guess, to the crisis in every single community, under bridges, in parks, on our buses. And I'll be honest, as somebody who organized our community's count for a decade, I had very mixed feelings about it, because it's an enormous amount of effort and people power and time to do something that is deeply imperfect. But I think what people are hungry for is a sense that there are solutions, that there are ways for regular people to engage, to bear witness to, and actually even reach out to and help the people whom they see struggling in their immediate neighborhoods, and to have better answers for family members, especially kids, who say, you know, how come those folks are standing outside in the rain? And getting good quality data is actually a point of pride, I think, for many of us who participated in it, whether it's the sheltered or the unsheltered count. But I really deeply agree with you, Marc, that there are other ways that we can listen where we need to listen. And fundamentally, at this point in our community, whether the number that is generated by whatever methods is 10,000, 12,000, 15,000, or 16,731, first of all, we know it's at least 3 times that many people through the course of a year. And second of all, it doesn't change what we have to do. So I think that there's a really important opportunity here for us to not get stuck in this particular task, because it is a task assigned to each community by the federal government, and to really think about what do we gain and lose and what do we want to lift up collectively. I think what's missing in our community and in many others is a strong sense of collective responsibility. And I know that you certainly experience that and speak about it powerfully, Marc.
I see a question here, and I'm going to sort of try to synthesize a couple questions. I see a question about people who stay temporarily with friends and family, couch surf, people that qualify as technically homeless, perhaps, but are not people that are visible on the streets. And I want to hear from the panelists, whoever wants to take this, what are some of the best practices for both, reaching those folks, who don't necessarily score high on all of the prioritization, lists and maybe get missed, and also, addressing the problems that Alison brought up at the very beginning. Rent is too high, and people are falling into homelessness. We have eviction moratoriums that are ending. So what are some of the best practices for preventing people who are just on the edge of falling into homelessness, and for finding and helping folks who are maybe just at the brink of becoming unsheltered? And I'll just let whoever wants to take that jump in.
I can speak to finding people. The best way to find people is through social networks. So it's one of the reasons why we're so keen on peer work and really making sure that our outreach workers across all the organizations are paid and have the capacity to do their jobs, is because how you find people who are sort of invisible, right, is they're not invisible. Somebody knows them. Somebody knows what's happening, right? And that's actually the best way, right? And in the youth space in particular, where a lot of young people who are experiencing homelessness are couch surfing, or oftentimes also vehicle residents. The best way to find out who they are and what their needs are is because an outreach worker or a peer navigator or someone talks to someone who knows them, and then they either then call that person and say, hey, I met this cool person, Alison, who might also be able to help you. Or sometimes they just give the outreach staff person or the peer the name and say, hey, I have a friend who also needs your help, right? So I think it's just really important that we be clear that, and this is, something that the authority is really, again, focused on, is that the people, again, it all happens to people. So the relational architecture is already there. It's whether or not the system leans into that relational architecture and values it, that determines whether or not a person receives the assistance, or continues to be on the fringes of what help might be possible.
Anybody else want to jump in on that one?
Well, I just think it's helpful for this question to have been raised, because I think it gets at what's happening in our system overall, where some people might have the observation that homelessness has grown over time, therefore we are incapable of getting people out of homelessness. And that isn't true at all. People are being exited from homelessness, is sometimes the terminology, all the time, into situations that meet their needs. And as I said earlier, the housing that's been created for people experiencing homelessness has been quite effective at doing that. but there's a constant stream of people falling into homelessness due to, you know, the problems we've already discussed here, especially the rising rent problems. The challenge that every community has is identifying the best way to prevent people from falling into homelessness. And a lot of the studies that have been done have showed that, well, it's really hard to actually be correct in targeting your resources very closely to the right person who was going to end up experiencing homelessness if you didn't provide those resources. The bottom line is a lot of people are living close to the edge, and probably all of them need support. Maybe a bunch of them won't end up becoming homeless without that kind of support, but we're in this mode of having limited resources, so we're constantly worried about how best to spend them overall. And the social safety net in our country is just, you know, terrible. If it was much stronger, you wouldn't have this constant inflow of people into homelessness.
Well, thank you. I have been, sorry, was somebody else jumping in? Alison?
I was just going to note very briefly that this comes up with respect to school-age children experiencing homelessness, because there is a different federal definition that can be used, which can include children who, with or without their adult family members, are doubled up or staying with other people because of economic circumstances, as opposed to those who are quote unquote literally homeless on the street, in the shelter, or in transitional housing. And one of the excruciating issues related to that is, you know, that actually doesn't even begin to account for the kids under age 5 who are included one way or another. And I think we can all understand the arbitrariness of making a distinction between a young person who is, you know, tripled up in a family setting where there isn't enough space for people, and somebody who is living in a vehicle attempting to do their homework by the light of the overhead light before the battery runs out. So, you know, as we have forced service providers, nonprofit providers, and government entities charged with this to, in some cases, do the absurd, require that somebody spend a night unsheltered so that they have their eligibility for a service that is only available to someone who's literally homeless. We've sort of come to accept these distinctions as acceptable, but they are not. We really need a much deeper way of both focusing homeless service dollars and having a much more significant way of helping people who need help.
Great. All right. I am over my time, so I'm going to make my my little outro here brief and just thank all of the panelists so much for spending time with us tonight, and thank you to the League for sponsoring this event and all the work that it took to make this happen. And I'm going to hand the mic back over to Adele, who's going to talk a little bit about the League's next event coming up in January.
Here we go. Well, and the first thing, of course, Erica, is to thank you for moderating, and for each of these visitors, speakers for us tonight. Alison, Daniel, Marc, Cynthia, you each brought your particular areas to light, and we know we could have talked all night. But we really appreciate your being here. We appreciate Peter Shapiro, who really led the planning of this forum. And of course, we thank all of you who joined us as audience and who submitted questions. Together, we seek to be a community where everyone has access to shelter that is safe and welcoming. So moving on, next month, Our January forum will focus on our own organization, the League of Women Voters of Seattle-King County, as we explore what we most want to do in the coming year. First, we need each of you members to take the survey. You got it in an email, and it's also in the December voter. And then be ready on January 6th to share your thoughts. What will be new for us in 22? And if you're interested in becoming a member and weighing in on the direction of our advocacy, visit our webpage or click the QR code on the next slide. There are 2 QR codes on that one, actually. And join us. We'll be glad to have you.